Welcome to the second episode of Script Talk, the student pharmacist podcast at Pitt. So today we're going to talk about standardized patients, and it's a great tool that Pitt Pharmacy offers. This episode is special because we have our very first guest, who is a huge expert in standardized patients, Dr. Catherine Rebitch right here. So Dr. Rebitch joined the faculty here at Pitt Pharmacy in 2019. She is a board-certified ambulatory care pharmacist and is passionate about improving access to care for underserved populations. She maintains a clinical practice as a family medicine pharmacist at UPMC Matilda Tice and volunteers at the 9th Street Clinic in McKeesport. And within the PharmD curriculum, she coordinates the Pharmacist Patient Care 1 and 2 courses and contributes to the non-prescription therapies in the self-care course. In addition, she acts as a preceptor to P1 students at the Homewood Community Engagement Center. And not only is she incredibly involved in pharmacy inside and outside school, she's also our advisor and has contributed greatly to the podcast here. So thank you for coming on, Dr. Rebitch. We really appreciate you having here.
Thank you so much for having me.
No problem at all. So I guess let's just dive in right here with the standardized patients. So it's going to be about, with our first segment here, we're going to talk specifically about the SPs. Okay. So what exactly is a standardized patient? Because you might go to other schools of pharmacy or ask other students in pharmacy curriculums, and a lot of them might not know what that is. So could you tell us a little bit about them and how exactly that fits into the health sciences curriculum at Pitt?
Yeah, absolutely. So you're right. Not all schools of pharmacy have access to a standardized patient program. So we are pretty fortunate at Pitt to have that. Our SP program is actually through the School of Medicine. It's been going on since 2001. At Pitt Pharmacy, we've had standardized patients, or SPs, as we often will call them, in our curriculum since 2008. So this has been going on for a long time.
Wow, yeah.
Yeah. I think probably one of the most important things to remember is that the standardized patients are more than actors. They are actually individuals from the community that are specifically trained to basically reproduce material consistently, right? So if we think about having a case and making sure that students are assessed on that case appropriately so they can build their skills. The SPs are trained specifically in communication and providing feedback. And they're also trained to work with students of various health professions. So in thinking about the different skills that you might practice as a pharmacy student versus in medical school or nursing, they really have a wide range of skills there.
Wow, that's amazing. So it's like first-year students, they get experiences with complex patients right out of the gate here. Absolutely. That's amazing right there. Absolutely. I can even speak to that as a pharmacy student myself. I remember seeing some of the standardized patients and thinking, oh my goodness, like some of these can be so complex you'd never think you'd see it in the community. And then you go to work in a pharmacy and here you go and have these complex cases right here. It's an amazing program that we have. So specifically with P1 students, they interact a lot with the Jones family, which we all know about.
Everyone's favorite.
So how do the faculty prepare for a standardized patient activity?
Yeah, that's a great question. There's actually a lot that happens behind the scenes. You mentioned the Jones family, which is the pivotal first experience, right, that our students have. And in the course that I coordinate that's called PPC, or Pharmacist Patient Care, we focus heavily on patient communication and really those, first experiences in collecting a medication history, collecting information about that person. And so much of that is communication skill, right? You're not quite at the point yet where you're making a therapeutic decision or full-on clinical decision making, but you are learning how to connect with a human, right? And figure out what their needs are. So Jones Family really allows the P1s to have that experience for the first time in a safe space. So you're meeting a member of the Jones family. Essentially, they're coming to a community pharmacy. They're receiving a medication review. And so it's really meant to be a confidence builder, in that you are practicing those skills in essentially interviewing that patient and determining how you might be able to help them as a P1 student. So behind the scenes, as faculty and also as our wonderful staff helps as well, we do everything from figuring out like the schedule and logistics of the event. So what is going to happen in the classroom? How long might that take? How many SPs do we need? Is this going to be an activity where students receive verbal feedback? Are they practicing with a rubric? Is this higher stakes? So kind of the assessment piece as well. And then so both faculty and staff, we work closely with the SP office. So there's a whole office of folks that manages. I think there's probably like 160 or 170 SPs like throughout the whole program. And there's a dedicated staff that actually help us to figure out demographics of SPs, right? And making sure that the SPs that are coming into the classroom are well equipped to work with our students. So there's actually a lot more that happens, I think, behind the scenes sometimes than students realize. Sometimes the day of the SP event feels easy, like compared to, all of the build up to it.
Oh my goodness. Yeah. I didn't realize there was that much integration there behind the scenes. Yeah. I mean,
thankfully we've been doing it for a while. So with a lot of these events, like we have, maybe cases that we're updating rather than creating something new. But it is still, a lot of logistics on the back end.
I'm sure that the logistics behind that definitely helps to create those great experiences that you get in your first year. Yeah. So speaking of, I guess, the integration, which, I mean, again, it's just amazing that the SPs have been integrated into not even just the pharmacy school. I think it's been in the medical school and all across the health sciences here at Pitt. So how has this integration with the standardized patients been integral into the curriculum for, let's say, advancing the students' learning experience and their professional growth here at Pitt?
Yeah, I can't say enough about it. Before I came to Pitt, I was on faculty at another institution. I had a great experience there. We had a robust curriculum, but we did not have SPs. And so actually when I came to Pitt, working with standardized patients was something new for me. And I have really seen how it impacts the growth of student confidence. I think the biggest thing is, again, with P1s, right? We have a lot of P1 students who may have work experience out in the community. But we certainly have P1s who don't, right? So I think just thinking about exposure to a simulated health environment helps students to feel confident so that when they go out on their experiences, their introductory experiences, it's not the very first time, that they've had to maybe professionally introduce themselves to a patient or figure out what those patients', primary needs for the day are. So again, back to that communication, I think that's huge. The other piece that I've really seen an impact, I think, is on building complexity. So, in the P1 curriculum, we're focusing a lot on that collection of information, right? Not so much what we're going to do with that information just yet. But if you look all the way from P1 to P3, we have capstone experiences for our third year pharmacy students where they are maybe in a hospital setting, taking care of a patient who's got 7 or 8 conditions. They are practicing not only with the SP, but with a standardized colleague. So they're practicing how to deliver a recommendation to a physician or a prescriber. And a lot of times if you tell the P1 student, oh, you're going to get to the point where you're doing this, right? They're like, oh my gosh, no, I'm nowhere near that. Well, you're not yet, but you will be, right? So I feel like I've really seen the progression in confidence and communication, but also in dealing with a more complex and realistic situation.
Absolutely. I feel like as a Pitt Pharmacy student myself, I've seen that with me.
I'd love to hear your perspective on it because you've been part of the way through it.
Oh my goodness. I remember getting to see the Jones patients the first time in our patient care class. And, we received a rubric and we're taught on, the professional and this a standardized way on how to speak to a patient. And that first interaction, you're just trying to hit a lot of those bullet points, and it's kind of regimentalized, if that's a good term to use right there. And over the past 2 years so far, as we've been continuing to do more SP interactions and getting more and more pharmacy experience, I can feel myself getting more confident with my communication skills, like you said, and with these more complex patient cases. In fact, in the community pharmacy that I work in, I actually performed a comprehensive medication review, which is very similar to these standardized patient interactions here. It follows a lot of even the similar documentation that we use as well. And the patient in question, he was on duplicate therapy for eye drops and glaucoma, and I was able to catch that all on my own. And I was able to counsel him on that, and he was able to go to his PCP and his eye doctor, and he came back to the pharmacy next week, and he said, "Ryan, thank you so much for helping me out with that. Like, you really saved me a ton of trouble right there." And I mean, that made my day, because when we're doing something like this, you don't in the moment think that, oh, this is I could be saving someone's life with this, just with the power of prevention. But
that's awesome. And it kind of, proves that there's a method to the madness, right? So if you think about kind of the faculty planning, right, and figuring out how are we going to design these experiences, a lot of what we are doing is trying to make them as realistic as possible, right? So when we do, for example, medication review in a community, or if you're making, let's say, a self-care recommendation for an over-the-counter product, as faculty, we're trying to make sure that even though this is a simulation, that it lines up closely with what you actually do see out in the real world. Because again, at your internship, you were able to pick up on that and say, oh, okay, I've done this before, right?
Right.
So it really adds to that, building of your confidence.
Oh, absolutely. And again, you might not think that for some of these cases, you might not think you're going to see them in the community, but I'm going to tell you, you certainly will. And then, of course, with a huge program like the standardized patients here, there has to be a lot of challenges that you face with it as well. So, I mean, when building the assessments for our student pharmacists, I mean, what kind of goes into that, and what do you see? How does that work?
Yeah.
And I mean, what challenges do you face as a faculty member? What do you see in the students?
Yeah. A couple of thoughts. So one thing I'm always thinking about is assessment, right? So it's one thing to, design this activity and have the students do it, but as a faculty member, I want to make sure that you are actually progressing, right? And so one of the things that I think is challenging, but for good reason, is to make sure that we are assessing your skills fairly and in the right way, right? So the standardized patients, they are trained in consistency. So when we create a case, there's 120 students per class, right, in our pharmacy program. So we're not creating one case, we're probably creating 12 cases, right? So if we have a bank of cases that we're asking the SPs to portray, we have to make sure that their portrayal is realistic and consistent. So again, a challenge, but I think some ways that we've worked to overcome these challenges are debriefing with the SPs before and after every event. So we will meet with the SP group and with any faculty and staff that are involved, make sure that everyone's on the same page in terms of learning objectives, what type of feedback's being delivered, is this a practice activity versus a graded activity, right? Because again, we want to make sure that everyone's getting a pretty even playing field, in terms of how you're able to assess your skills. I think the other challenge that, again, I've seen some improvements with, but we're always working on, is making sure that there is truly a realistic portrayal. You all are out in various communities and neighborhoods. We want to make sure that the SP experience and program reflects diversity, right? We want to make sure that students have an opportunity to talk with patients that are in the LGBTQ community. Not all the patients that you're going to interact with are a 70-year-old male, right? So we want to make sure that the SP program at large is also committed to having that realistic experience. And that's actually something that I have seen improvement in just in my time at Pitt. So I would say that's a big initiative that, it can present a challenge if we feel like we're not giving that realistic experience. But I think they've done a lot of work to make sure that they're recruiting diverse SPs as well.
Oh my goodness, that's amazing. So, I mean, here in Pittsburgh, we're just getting such a wide breadth of patients and populations that we get to see all across the globe. And that's just amazing. And the SPs, I mean, they're getting trained on this. I'm sure you've seen a lot of that with medications and how to deal with students, patients. That's just amazing right there.
Yeah.
All right. Well, I think that's everything for our standardized patients right there. We're going to move this on to our second segment, our pharmacy innovation segment. So we'll see you back here in a bit.
Welcome to this episode's Pharmacy Innovation segment, where we highlight different areas of pharmacy innovations and pharmacy news. Now, it is no secret that the role of technology in our everyday life has been growing every year. Home, school, work, entertainment, there's a role for technology everywhere. Now, think about how technology can be used in the field of pharmacy. Patients can receive automated text messages when their medications are ready for pickup at the pharmacy or when it's time to refill their prescription. Patients with diabetes can wear continuous glucose monitors that connect to their smartphone and allow them to easily check their blood sugar levels. You've probably come up with these examples on your own, but let's talk about some unique ways that technology can help patients. Smartphone applications like MediSafe and EveryDose can be helpful to provide reminders to take medications, store information about prescriptions, and generate medication adherence reports. These tools are especially helpful for caregivers who need to keep track of a number of medications, or for senior patients with a complicated medication schedule. Staying on the topic of adherence, Abilify MySight is a uniquely designed tablet that tracks when each dose is taken. Abilify MySight is made of aripiprazole, an antipsychotic medication, and a sensor called an ingestible event marker. When a person takes the medication, a signal is sent to the MySight smartphone application that the patient took their dose. It is a great data collecting tool for those who manage patients with complex mental disorders and need to know whether the person took their medication or not. Abilify MySight has to be prescribed to a patient by a licensed healthcare provider. But did you know that doctors can also prescribe applications that can be accessed through your phone or computer? Such apps are called Prescription Digital Therapeutics, or PDTs, and can provide treatment for behavioral and mental disorders. The U.S. Food and Drug Administration oversees PDTs for safety and effectiveness, like any actual prescribed medication. Some examples of PDTs include Sommerst, which is used to treat chronic insomnia, Reset, which treats substance use disorders, and Nightwear, which treats PTSD. Needless to say, technology already has a large presence in helping people manage their conditions, but it'll be interesting to see it grow even more in years to come. Isn't that exciting?
All right, and welcome back to our third and final segment of the episode right here, rapid fire questions. So these are just going to be some quick, non-complicated questions just to ask you right here. So first question right off the bat, what area of pharmacy are you interested in?
Yeah, well, I practice mostly in what's called ambulatory care. So that is clinic-based pharmacy, outpatient pharmacy. The way that I look at that is chronic disease management. So I am evaluating every medication on my patient's medication list, trying to figure out if there's a way that I can improve their condition. And I do a lot of that in collaboration with physicians and nurse practitioners.
So very similar to like primary care in that environment, because I think I saw somewhere online where a lot of people might get confused with the term ambulatory.
Yeah, so think ambulatory, patients walk to you, right? I'm not in a hospital. But you're right, ambulatory care is a really broad term in pharmacy. You can be in a variety of clinic settings. I am currently in a family medicine clinic, which essentially means that our patients are from age 0 to 100. So most of the patients I communicate with are a little bit older because they have multiple chronic conditions. But the office that I practice in does see pediatric and geriatric patients too.
So you can get that with a lot of populations in the community here.
Yes.
Awesome.
Yes.
And then when you were in pharmacy school, not so long ago, what was your favorite class in pharmacy school?
Yeah, well, so actually it's been a little over 15 years since I was in pharmacy school. So I don't know if we can say it's not that long ago, but I appreciate that. So I did not go to Pitt. My curriculum was a little bit different. I actually had a little bit more pharmaceutical sciences courses when I was in school than you guys do now. So I actually really enjoyed medicinal chemistry, and it was a hard class, but it was honestly one of the reasons why I became interested in pharmacy when I was in chemistry classes in high school. I wanted to learn about how drugs worked in the body. So I loved med chem. Interestingly enough, my favorite therapeutics class is something that I never do now, which was infectious disease. I loved ID when I was in school, bugs and drugs. And then I just quickly realized when I was actually out in practice that that's not actually my jam. So it's interesting, like you might connect with something in the classroom and then you get out in practice and realize that, yeah, you like a whole different set of things.
Oh, yeah, I remember in our infectious disease class when we were learning about C. diff infections, they got to the part in the presentation about some microbiota transplants there, and I could just feel the aura in the room.
A little bit too much for you.
A little bit too much. It's one of my favorite classes as well. But yeah, I can definitely see where
you need good ID pharmacists, but that's not me.
Absolutely. And then, of course, you're a person outside of pharmacy as well.
I am.
So, I mean, what sort of hobbies do you like to do outside of pharmacy? Do you have a favorite one?
Yeah, so I actually really like baking. And so that's kind of what I call science in the kitchen, right? Because baking is very precise. But I enjoy it. It relaxes me. I like to kind of come up with a new recipe or a project that I'm working on in the kitchen. I find that a lot of fun. And I'm also a big sports fan. Not personally very athletic. I don't play sports per se, but I love watching football, hockey, even golf. I went to a U.S. Open practice round this past week and it was awesome. So I am definitely a big sports spectator.
Absolutely. Yes. I mean, you have to be a Pittsburgh sports fan here at Pitt.
You do.
There's no other way around that.
That is a must.
So if you're on there and you're a Buffalo Bills fan,
say no.
Don't do it. Now, if you could have a superpower in pharmacy, like pharmacy Superman, what would it be?
Yeah, so I don't know what the name of this would be, but my pharmacy superpower would have to do with affordability. So healthcare, is increasingly expensive. Medications are increasingly expensive. So if I had a superpower, it would be to help all patients afford and access their medications.
If
you can figure out how to make that happen, that's what I would do.
I wish. I was just in the community last week, and someone came up for their rifaximin medication that they needed for their mother. Their insurance wouldn't cover it, and they had to pay $1,100 for that medication. They had to give a check to us at the pharmacy. It was terrible. And of course, that's not the only case I see with affordability issues. I'm sure you see so many of them as well. And it's an unfortunate area of practice that we have to deal with, and we have to try and make the best outcomes for our patients with it.
Well, and I think, as pharmacists, as student pharmacists, that's actually a way that we can help our patients quite a bit. The system is not perfect, it's far from it, we know that. But I think that if you talk to patients, you'll find that, sometimes you got to go to plan B or plan C, but a lot of times we're the healthcare professional that tries to figure out cost. So whether that's, maybe somebody who doesn't have insurance, maybe getting them something through a manufacturer program, helping a patient who does have insurance with a coupon. You know, I mean, there's little things that we can do that could make a big difference for somebody. But yeah, that would definitely be my superpower.
Absolutely. And then, if you could be a drug, any drug in the world, what would you be?
Yeah, so I've thought about this because, you know, you get questions of, oh, if you brought a medication on a desert island, you know, whatever.
Pharmacy icebreaker.
Yeah. I have settled on good old Dramamine. So an over-the-counter diamond hydrogenate, not meclizine, for those of us who remember our product line extensions. The reason is I'm actually very prone to motion sickness. Whether that's, you know, being in a car, on a boat, pretty much anything that moves. If I am not driving, I'm very prone to getting sick. And I actually, my family figured this out when I was quite young. And so I have a very early memory of my mom giving me, you know, like half of an orange chewable Dramamine tablet, right, before a long car trip. And so that is my core memory of like a medication working for me, right? And so for whatever reason, that's the one that sticks in my mind. I still use it to this day if I'm like on a long car trip and not driving, or if I'm on a plane. Yeah, it's like my favorite. Oh. So I guess if I had to be a medication, that would be it. Did it save my life?
Hopefully it was a good tasting medicine as well, right?
Well, you know what? It was a blessing when I learned how to swallow tablets. Because let me tell you, if you've ever taken something that's chewable and orange, it's not.
Oh. Well, I know there's some...
But it's better than, you know, being sick in the backseat of a car, so...
Oh, that is true. There's probably a worse taste for that than the Dramamine, so that'll have to do.
Yes.
All right. Well, thank you so much for being on our show, Dr. Rebitch.
Thank you for having me.
Oh, no problem. We really appreciate having you on.
I'm looking forward to seeing all of the great episodes that you all put out over the next year and beyond.
Absolutely. Oh, stay tuned for that. And that's all the time that we have for the second episode of the Script Talk Student Pharmacist Podcast. Special thanks, of course, to Dr. Rebitch for being our very first guest, which is such an amazing honor. We're going to have to get you a plaque for that.
Very honored.
Yes, or another mug for you as well. And we look forward to seeing you again soon for your next dose of Script Talk.